All right, Utah Food Handler Section D, Employee Health and Hygiene, SafeFoodTest.com. Poor personal hygiene can cause a foodborne illness when food handlers fail to wash their hands correctly after using the bathroom, cough or sneeze on food, touch or scratch wounds and then touch food, or work while they're sick. Food handlers can cause or contribute to biological, chemical, and physical hazards. Remember, food handlers are the front line of food safety. You got to check yourself before you wreck yourself. Last time, I'm going to warn you, there's different types of enemies out there that are trying to injure us, kill us. They're biological, chemical, and physical in nature. And this is warfare. It's us versus them. Food handlers are the front line. So you got to know about bacteria and viruses and parasites. You got to know about additives and allergens and heavy metals and toxins and things like pesticides and herbicides and insecticides. And you got to know about physical hazards like metal and glass and hard, sharp objects like shells and pits and maybe even dirt. So you got to know about all these things so you can prevent them, eliminate them, sometimes reduce them to an acceptable level. You already know that a foodborne illness is a disease transmitted to people through food. But you may not know that a foodborne illness outbreak is when two or more people have the same symptoms after eating the same food, and an investigation is conducted by a state or local regulatory official, and the outbreak is also confirmed by laboratory analysis. You must report any health problems before you come to work. You should also let your manager know immediately if you get sick while working. If you have a sore throat with a fever, then you must not be working with or around food. You must be excluded from the operation if you primarily serve a high-risk population. And you also must get a written release from a medical practitioner before you head back to work. If a food handler has at least one of these symptoms, vomiting, diarrhea, then the food handler must be excluded from the operation. Before returning to work, the food handler who vomited or had diarrhea must meet one of these requirements. They have had no symptoms for at least 24 hours, or they have a written release from a medical practitioner. If a food handler has jaundice, a symptom that could indicate that the food handler has hepatitis A, then the food handler will be reported to the regulatory authority. The food handler will be excluded from the operation if they've had jaundice for 7 days or less. The food handler must have a written release from a medical practitioner and as well as approval from the regulatory authority before returning to work. If a food handler is diagnosed with these foodborne illnesses, they may not be experiencing the usual signs, or their symptoms may be over sometimes. You need to work with your manager and the local regulatory authority to determine whether this food handler or you must be excluded from the operation or restricted from working around food, and when the exclusion or restriction can be removed. Remember, these are only guidelines. Working with your local regulatory authority will help you determine the best course of action. But the food handler is vomiting or diarrhea and has been diagnosed with one of these pathogens, Salmonella, E. coli, norovirus, or Shigella, then generally they will be excluded from the operation and required to have a medical practitioner and the regulatory authority release them for work. Whether or not a food handler has symptoms Those diagnosed with a disease caused by these pathogens, Salmonella typhi and hepatitis A, must be excluded from the operation. You'll have to work with the local regulatory authority and your manager to determine when the exclusion can be removed. Remember, these are only guidelines, and the regulatory authority will determine the best course of action. It only takes 20 seconds to save a life. Hand washing is the most important part of personal hygiene. It may seem like an obvious thing to do. Even so, many food handlers do not wash their hands correctly or as often as they should. A food handler must wash their hands and must monitor their hand hygiene. Hands need to be washed in a sink designated for hand washing. Do not wash your hands in a food prep sink, in a dishwashing sink, or a utility sink. It takes 20 seconds to save a life. First thing you do is wet your hands, using running water as hot as you can comfortably stand. Hopefully it's at least 100 degrees Fahrenheit. Number 2, apply soap. Apply enough to build a good lather. Number 3, make bubbles. Scrub hands and arms vigorously. Scrub them for 10 to 15 seconds. Clean under your fingernails and between your fingers. Step 4, rinse hands and arms thoroughly using running warm water. And step 5, dry your hands and arms. Use a single-use paper towel. Consider using a paper towel to turn off the faucet and open the restroom door. Food can be contaminated when it has been handled with bare hands. This is especially true when hands have not been washed correctly or have infected cuts or wounds. For this reason, do not handle ready-to-eat food with bare hands. There are times when it may be acceptable to handle ready-to-eat food with bare hands. This is true in the rare situations identified in the slides. Never handle ready-to-eat food with bare hands if you primarily serve a high-risk population. If your jurisdiction allows this, bare hand contact, you must have specific policy in place or make sure you follow your facility's policy. And you must also be trained in proper hand washing and personal hygiene. According to the definitions of the Utah Food Handler Certificate Rule, R392-103, double hand wash means to wash hands in a hand washing sink immediately after using the toilet or changing a diaper, and then washing again after entering the food preparation and food service area, but before handling food. Food handlers may not contact exposed, ready-to-eat foods with their bare hands and arms. Food handlers shall minimize bare hand contact with exposed food that is not ready to eat. Food handlers contacting ready-to-eat foods with their bare hands shall use double hand washing. Food handlers serving high-risk populations shall not contact ready-to-eat foods with their bare hands. Food handlers must wash their hands before they start work and after using the restroom, handling raw meat, poultry, and seafood, of course before and after, touching the hair, face, or body, sneezing, coughing, or using a tissue, after eating, drinking, smoking, or chewing gum or tobacco, handling chemicals that might affect food safety. Make sure you wash your hands appropriately. Food handlers must wash their hands after taking out the garbage, clearing tables or bussing dirty dishes, after touching clothing or aprons, after handling money, after leaving and returning to the kitchen or prep area, after handling service animals or aquatic animals, after touching anything else that may contaminate hands. Hand washing sinks should be put in areas that make it easy for staff to wash their hands. Make sure these hand washing sinks work correctly and that they're well stocked and maintained. Make sure they're also available at all times. Hand washing sinks cannot be blocked by portable equipment or stacked full of dirty kitchenware or dishes. Hand washing stations, hand washing sinks need 5 things to be operating properly. Number 1, they need hot and cold running water. Number 2, you need soap. Number 3, you need a way to dry your hands, preferably a single-use paper towel. Number 4, a garbage container. And number 5, a sign that says, wash your hands before going back to work. The water must be drinkable and meet temperature and pressure requirements. Disposable paper towels are preferred for drying hands. A garbage container is required for disposing of the towels, and the sign must tell staff when to wash hands, and make sure you do it before returning to work. And make sure you have other languages if you need it on the sign, or tell your manager to get one. Food handlers must wear a clean hat or other hair restraint. Food handlers must wear clean clothing daily. Food handlers must remove aprons when leaving food preparation areas. Food handlers must, except for a plain ring, such as a wedding band, remove jewelry, including medical information jewelry, from hands and arms before prepping or when working around prep areas. Infected wounds or cuts contain pus must be covered to prevent pathogens from contaminating food and food contact surfaces. How a wound is covered depends on where it is located. Cover wounds on hand or wrist with an impermeable cover, a bandage or a finger cot, and then a single-use glove. Cover wounds on the arm with an impermeable cover, such as a bandage. Cover the wounds on other parts of the body with a dry, tight-fitting bandage. Food handlers must keep their fingernails trimmed and maintained. Unless wearing intact gloves in good repair, a food handler may not wear fingernail polish or artificial nails when working with exposed foods. Eating, drinking, smoking, and chewing gum or tobacco. Food handlers must not eat, drink, smoke, or chew gum or tobacco when working in prep areas, when working in areas used to clean utensils and equipment, when preparing or serving food. Food handlers must wash their hands after eating, drinking, smoking, or chewing gum or tobacco. Well, I know you know by now, a foodborne illness is a disease transmitted to people through food. An outbreak is when 2 or more people have the same symptoms after eating the same food. An investigation is conducted by a local regulatory authority, and the outbreak is confirmed by a laboratory analysis. You're in the foodborne illness prevention business. There are certain segments of the population that are a higher risk for contracting foodborne illness. These people are elderly people, infants and preschool-aged children, people with compromised immune systems, the body's defense system against illness, people with cancer or on chemotherapy, people with HIV/AIDS, and transplant recipients. They have a high likelihood with a small dose of getting foodborne illness. Remember, as food handlers, it's our job to make sure we deliver safe, wholesome meals to our customers. At Safe Food Test, we know that that's not necessarily easy, but with this training, you are given very important information which you must now implement day to day at your facility. Is your food safe? Most importantly, we hope you deliver safe foods to your customers. And secondly, we want you to pass this final exam, which requires a score of 75% correct. You'll then receive a certificate that's good for 30 days that you'll take to your local health department, and they will issue your formal permit